thanks for coming out on a Saturday morning after this really thought-provoking several days here at the forum. And Anne, hello.
Hi, good to see you.
So before we dive in, Anne, I want you to settle a long-running debate.
Oh,
Coffee.
Coffee. Yes, very important.
What does the 23andMe research team have to say? Is it good for you or bad for you?
I did tweet that yesterday, which you had mentioned, that there was a paper about how coffee is actually really quite good for you. And I do love coffee. And we do have this report about how you metabolize it. Are you a fast metabolizer or a slow metabolizer? And I was really upset when I was pregnant because they tell pregnant people not to drink coffee. So, fortunately, I have this genetic testing company. And so when I did my amniotic cells, I actually sent them off for analysis, and I saw that my fetus was could metabolize coffee fine. And then I continued to drink coffee. So it was a data-driven decision.
I'm glad you came down there because I wasn't going to accept any other answer.
Oh, yeah, 100%.
So, Anne, before we dive into some of the issues that I think people want to hear about, can you say a little bit about yourself and how you came to this line of work in consumer genetics?
My background, I always loved science. I grew up in an academic family, and I loved science. And I remember hearing the first time my mom was yelling at my sister in some capacity about her jeans, and I was like, but she's wearing shorts. And it was super confusing, and I asked my mom about the genes, and she was explaining genes and environment to me. And I was totally captivated. I was like, what do you mean? Like, you have this code, and then if you understand what you're supposed to do in your environment, then you could follow this path about like how to live your life, and you could optimize. And I became obsessive with twin studies. I remember when National Geographic came out with one of the first twin studies, and I would like obsessively read this as a child. So I always was fascinated by that intersection of genes and environment. And then I ended up working on Wall Street for about 10 years and loved it, loved biotech. There's nothing more interesting to me than the human body, and it happened to be right when the human genome was being sequenced. So there was this, incredible euphoria about what the potential of the future was going to be. Suddenly, the human genome was going to change how we diagnose, prevent, and treat all human disease. I was super excited. And then frankly, as I got to understand how healthcare works, I realized the healthcare system's really not built for us. It's really not, it's set up for, for individuals who are sick, and it's really set up for, maximizing monetization and also maximizing what's going to benefit the most number of people. But when you're on the tail end, you're kind of excluded. And I had all kinds of really unpleasant experiences where I'd be talking with companies and hospital groups, and they would talk about patients, but then the patient never had a voice. And I remember saying at one point, well, what if the patient wants something else? And they're like, no, they're not a decision maker. And so after about 10 years, I became more and more disenchanted with the healthcare system and how I could really monetize, diabetes, I could monetize dialysis. I could do this great talk about the coming era of obesity and the ultimate moneymaker and all the different diseases you could monetize. And I decided I really wanted to leverage the power of the individual who actually is in charge of their own health and empower them and wake them up and realize you have the opportunity to get access to your data, and you're actually in charge of yourself. You have the right to your medical record, you have the right to your genome, you have the right to, direct the care, to see the people you want, to understand what is happening to you. And so 23andMe was set up really almost as this revolution, as an agency to empower people to rise up, learn about themselves, and take action. And again, one of the things I just realized, that issue of, prevention's not really part of the system in a major way. That's one of the best things you can get from the genome, and really wanted to empower people to do that.
So this is a big vision. It's empowering, uplifting, centered around the individual. You got this thing started 2006. Mm-hmm. And your first product, remind us what that look like in terms of what the consumer would pay and what they would get?
It was $1,000, and the consumer was getting a lot on their ancestry, and they had 13 reports. So that was like the big revelation to us. Our scientific advisory group was not comfortable with us putting out tons, but we put out these 13 reports. And we launched, and it was great. We had a big launch party. We were the cover of the New York Times and of Wired magazine, and it was seen as like the coming era. And our scientific advisors, the minute they got their own data, they were like, unleash the beast. We want all the data. And we allowed people to have access to the whole genome and the ability to download everything, which again was sort of in this mindset of like a consumer's right. And it was great. Like people were really excited about it. But then there really wasn't market demand. And we went from selling 1,000 kits the first day to then selling about 20 to 25 kits a day. And any of you who have an MBA can realize that's not a sustainable business. So then we were very grateful, obviously, to Illumina for finally making the chip cheaper. That allowed us to lower the price. And as we were able to lower price, we were able to drive volume.
Now, there was also a bump on the road there where the FDA said, hey, wait a minute.
Oh, was there?
Yeah.
Oh.
You can't offer people health claims. You can't make claims.
Oh, yeah. No, the first year at the American Society of Human Genetics, I think it was here even, we went and we were kicked out of meetings. I had one presidential advisor get up and leave a dinner with me. Like, he was so upset. He was like, children around this country are gonna be abandoned because of you. And I was like, really? Like, why? And then I had like pitchforks. Like, people were so angry at this idea of people having their information. And so when we did get our warning letter in 2013, I was somewhat cavalier about it originally because we'd had so many previous warning letters. And we'd had from the California Department of Health, and we'd had Senate hearings. And it was really, it's so interesting. It's such a hot button issue when you empower an individual. Like, the heart of the controversy was like, are you all capable of understanding your genetic information? And frankly, one of the proudest things one of the proudest moments for me of 23andMe is when we did get our FDA authorization. Because what we fought for was not just that, genetic information is accurate, et cetera, because we already knew that. But what we proved out is that all of you, the people, are in fact smart enough, capable enough, with the right infrastructure to get your genetic information on your own. And one thing that I do really rebel against is this mentality in healthcare is that you are not capable of changing, that you're not capable of understanding information, that you're never going to follow it. So I was really proud that we now have over 7 FDA authorizations, and we've proven out that people can, in fact, get really complicated information like a pharmacogenetic result or a BRCA result directly. They can buy it directly, and we can return those results directly.
Okay, so let's expand on how the product has evolved over time. There's 80 different health tests within your single test, and the cost is?
Now it's $199 for health and ancestry and $99 for just ancestry.
So the price has come down. The product is a lot more informative. Mm-hmm. You now have 13 million people who have gotten the test. So tell us a little bit about what your database looks like now, 16 years in terms of the breadth and depth of it.
I think, the database, frankly, is pretty remarkable, and it is thanks to our customers. And I also think it's again, one of the other things that we challenged is this notion that people don't want to participate in research, or that it's hard to get people to participate in research. I feel like the number one thing I'm an advocate for is that people want to be empowered in health, and that this sort of communist mentality we have of Big Brother has to take care of you is not correct. People want to be empowered. So 23andMe asks customers if they want to opt into research. And I should emphasize, it's an opt-in. We don't default you. We give you that choice. And over 80% of our customers elect to participate in research. So we do now have over 13 people who've done it.
13 million.
13 million, sorry. Good, thank you. Add that million on. So we have over 13 million people who've done it. It is, 70+% European. But the fact that it's 30%, roughly 30% non-European means it's the most diverse database out there. So it is absolutely a priority for us to bring in diversity into the data set and make it accessible to everyone. And the ways that we really do that is by making sure that it's affordable, as well as there's as few as barriers as possible to getting access to it. But the database, again, when I think on other pitchforks that were coming after us, scientists in those early days would tell us, you're just doing a fishing expedition, bad data in, bad data out, people can't self-report. Again, this kind of theme that you are all incapable of talking about your own health, not realizing that what do you do when you go to the doctor? You tell the doctor about your health. So, what I'm so proud of as well is that this machine that we've built for research really works well. So people consent. We ask you to answer questions about yourself. If I know that you have asthma, I target you with an additional survey to get more additional information about the type of asthma, and then I can do research on that. And everything that we have is unlike when I look at Facebook and Google and other groups that do research, it's not IRB approved, it's not in that typical, the consent process. Everything for us was mindful of people and how we're gonna return results, how we're gonna structure it. So we have massive amounts of data, we have huge engagement and participation from our customers, and we have now over 200 publications. We have a therapeutic division. We are developing therapies in collaboration right now with GSK. There's over 50 programs, 2 of them are in the clinic. But the focus for us is, help people access, understand, and benefit the human genome. And with the kind of size and scale we have now, we're really focused on that benefit side.
I want to come back to this point about diversity a little bit later that you brought up, but what you're really describing here is you're connecting genotype and phenotype.
Correct.
And is making it social, and you're keeping this continuous line of communication with your customers, which is pretty rare, all of these things, and it becomes longitudinal. It gets more valuable with time,
Yeah.
Right? How do you do that? How do you develop the kind of trusting relationships that make that possible?
I think trust in healthcare, I think is everything, and I think part of it is just have to be really authentic. 23andMe we're not super, we have an extraordinary product, but we're not always super polished. We make mistakes. And I remember there's times where we would, we'd accidentally flip the plate, and we would return, 96 people would get the wrong results. And we would just call them and tell them, we're sorry, we're gonna give you a free kit. Here's the issue. We'd catch it really quickly, and then we're just really direct and honest with people. And I find that the way you build trust is, building a true relationship. And I think one of the things inadvertently that helped us was our FDA authorization, because it showed that we were really committed to consumers. We weren't just a business that's trying to we want to make money on the human genome. We're committed to proving out that you can all get it. That we're the only true direct-to-consumer company out there that's gone through the FDA in this kind of process. So I think, trust comes when you have a real relationship and when you engage, and frankly, it's through controversy sometimes. We do make mistakes, and we do engage. Even, on our ancestry composition, when we put out a, indigenous communities, and, some of your speakers here have advised us, they gave us a lot of really critical feedback, and we delayed our product launch over a year because of that feedback and really trying to do that right thing. But that then hopefully builds trust. So I do think that, broadly, we need to have that type of reputation, and how we walk our walk, the things that we do, that's everything. So it's hard though, it's hard to have an authentic brand, and I think it's hard to keep people engaged. And part of the way we do keep people engaged is we keep emailing. Like, we email when there's new reports. We email when there's new relatives, when there's new features that are coming out. But I think we've proven over time, like, we really are that advocate for all of you. We're like I'm invited to meetings all the time, not because of the litany of PhDs and MDs that I have, which I don't. But like I'm brought because I'm like that advocate for the consumer voice. And so often I go to medical meetings or other industry-wide meetings, and it's like an afterthought. Like, oh yeah, that's right, people are going to use this product. I'm like, yeah, they take your drugs, they do all these things. So we need, it's important for this whole healthcare industry to have a better relationship with the consumer. And I use the example of hepatitis C all the time. Like, it's a tragedy that we have all these incredible advances, we can cure diseases, and like the healthcare industry is not loved. So how do we change that? And I think part of it is that you need to have a real relationship with people.
You mentioned the old communist system there for a second.
I joke so much because I lived in Poland in '92, and I sometimes feel like the best training I ever had for understanding Wall Street was that experience of understanding communist Poland. Because I remember visiting, there's this old steel mill called Nowa Huta that ran at like 20% capacity. It was super inefficient, and I remember the woman telling me like, oh, we are very profitable because our profits are a percentage of our cost. And sometimes I feel like healthcare is like that. We're so good at billing optimization. I don't know if any of you have ever been to a billing optimization conference, but they're terrifying. It's like, how do I, like, you're coming in for a knee procedure. How do I get as much money as possible out of your knee? But there's no, and sometimes I get like the traditional healthcare world will come and kind of pat me on the back, and they're like, oh, it's so cute, you want to prevent disease. And one senior executive just reminded me that, like, Anne, you have to remember that no one rewards you for the absence of a condition, which is true. Like, if I look at this room and I say, I'm going to prevent type 2 diabetes in this room, I'm not going to get rewarded for that. But if I effectively manage your type 2 diabetes and I make your cost of like standard type 2 diabetes cheaper, then you can get rewarded. But that's why the consumer empowerment is so important in healthcare, because we would all rather stay healthy. Like the factor V mutation is an interesting example, because if you know that you have this mutation, which is roughly 20% of our customers, that women would take a different kind of oral contraceptive, you would potentially have a different type of management of pregnancy, that you would be more proactive when you're flying about blood clots. But healthcare executives have routinely told me that it's just cheaper to treat the people who have a pulmonary embolism than it is to prevent. So like, just raise your hand if you would rather have that pulmonary embolism than prevent it. And so, like, I don't see any hands. But that's the type of thing where I'm like, no, you guys, you're missing the consumer voice. And that's why there has to be a balance between like the traditional healthcare system and what the consumers own. And my long-term hope is that we can really develop this bridge. Like, we have, an army of consumers who want to be proactive with their information. They want to prevent, and that we'll give them those tools. And then when you do have a condition, that will bridge into the healthcare world. But the two have to live in coexistence, because I don't see a solution. Like, the healthcare world makes money off disease. Like, it's just the sad fact is that, like, I don't see how you move the ship. Like, it's just, that's that world, but we all care about our lifestyle. So we need to figure out better how we can all empower ourselves and like have that information so that you can make those choices and prevent it.
So this is what you're up against. It's a big leviathan.
That's why I drink a lot of coffee. I mean, it's tiring.
And the way you get around that is through building this army of consumers, as you say, and they can exert pressure on that system to some extent.
Yeah.
But 13 million people have participated thus far. That's pretty good. But this is a big country. There's a lot more out there, and including people of diverse communities.
Right.
Which you mentioned that your database is about 70% of European descent. What are the things that you're doing to improve your outreach to those communities that have not participated thus far, and to get most of us participating?
Yeah. Look, we need all of us, for sure. I mean, there's a reason why, if you look at our board, the people that we recently brought in, so we brought in Valerie Montgomery Rice, who is the the president of Morehouse School of Medicine, and Sandra Hernandez, who is also an advocate for California, Health Foundation and alternative systems. And, we think a lot about, how are we going to create products? Like, do we create an African-American product, for instance? Or product for African Americans that will highlight, conditions that are unique to that community, that are not unique, but common in that community, and that we can really help explain, these are things that you should be screening for, that you should be proactive about, that we can say there's really a benefit for you knowing this information. And I think the more we can actually create that kind of education for specific communities, specifically in health, I think we can start to win over those communities more and more. I do think trust is everything in partnerships, having the right type of advisors, hearing from people, creating the products that make sense are all key. Similar to what we did also with Indigenous communities, I do think having that right advisors and making sure that we're developing products in that right way is just, it's key. Like, you have to have that input from people. Again, going back to that top level, like, you want to hear from the people. Like, you want to hear what's unique, like, what are the thoughts, what are the concerns, how do we manage that, how do we help them understand that information? And I do think about things like sickle cell, like, why isn't everyone tested? It's crazy to me. Like, that should be something, and we should find ways and partnerships where we can make that really accessible to the whole community. So we do have an African American genome, a research project that we are engaged in, thinking about how we engage with the community. We have a number of diversity initiatives where we have looked to, find individuals, bring them in, make sure that our database is reflective for, that when we put out a new report, that it's applicable to all populations. So we have a lot of internal efforts to make sure that what we're doing is going to be reflective to everybody, as well as recruiting individuals or making sure that the product that we're building in the future is going to be applicable to everyone, and that we can create also specific products for specific communities if appropriate.
Now, longer term vision. I know in the last year you bought Lemonade Health.
I did.
How does that fit into this vision of outreach to a broader group of people?
Yeah.
Telehealth. For those who are not familiar with Lemonade, can you say a little bit about what it is?
I'll explain. Yeah. Lemonade is a telehealth company that also has pharmacy. Has an incredible physician group that was started by a Kaiser Permanente physician, or it was led by, the medical side was led by a Kaiser Permanente physician, and also has a pharmacy, so they have their own in-house pharmacy. And when I think about the challenges, like what's going to get us to universal genetic coverage, like the first panel right before Obama, like everyone concluded, it was an interesting conversation because it there was all kinds of controversy about various aspects, especially with 23andMe, but then also concluded everyone needs to get their genetic information. But there's so many barriers to getting to that endpoint where everyone is going to have their information. And 23andMe is 16 years old, and we've tried to partner with academic institutions, with NIH, with the National Human Genome Research Institute. We've created content. We've worked with University of Pittsburgh on like some pharmacogenetics content, but it's really hard to get physicians and the system at whole to change how they're doing things now and change that practice of medicine to adopt genetic information. And again, going back to that point that I had one doctor at a conference stand up. He said, look, the biggest problem with 23andMe is you generate non-billable questions. And it's true. And I think about like a dermatologist, like if you walk in and you say, I want a skin check, it reimburses like $25. But if I walk in, I'm like, hey, I want Botox, like that takes 5 minutes and it's $300. So what would you rather be doing? So I realized, like, after a long time, like, I think it's gonna be almost an insurmountable problem. Like, we alone can't try to change the whole system. Like, I think Illumina's done amazing work of actually getting reimbursement and like driving more adoption, but for the average individual in primary care, it's not happening in the next decade. So we acquired Lemonade with this idea that, well, I can just deliver care. Like, suddenly, you know, virtual care became normal. And we had always talked about delivering our own care, but it was still seen, like back, you know, pre-pandemic, it was seen as like, well, this is weird. And now it's no longer weird. So we acquired Lemonade with this idea that 23andMe is actually gonna deliver genomic-based care. I have 13 million people who have their genetic information, and there's absolutely actionable things for all of those people. And we hear all the time about people coming in with their 23andMe reports and going to the physician's office, and the physician's like, I don't know what to do with this. I mean, we even had a story just recently on like hereditary colon cancer, and it took them over a year to see a genetic counselor. So we hear these stories all the time of like, it's hard to get people who are educated. It's clearly a very unique subspecialty. There are real things that you can do when you know that you have this information. There's also lifestyle areas that we can really help advise on, like what are you going to, like how you potentially want to change your life, things like decisions you might want to make. So we acquired Lemonade with the idea that we can deliver that care, and as well as like we have a pharmacy now, so I can integrate pharmacogenetics. And I think pharmacogenetics is one of those areas, like it has such incredible promise, but getting it into that system right now is almost impossible. So that's where we have that ability to have a very affordable pharmacy where every prescription can have pharmacogenetics incorporated in it.
So you have your own physicians.
We have our own physicians, and I have the most amazing team that is sitting in the front row, Nora and Amy, who recently just joined, Nora from Mount Sinai and Amy from Geisinger, and leading up what is gonna be the training of our own team, training, like doing referrals with other clinicians, and so we're building up a genomic health, genomic medicine powerhouse of like, how do we actually deliver this care to 13 million people? And how do we advise, and how do we start to integrate in with the healthcare system? How do we actually do that physician to physician or healthcare provider consult? Like all those ways so that we can start to partner and really help people know if you are high risk for chronic kidney disease, there are things that you can actually do about that.
Okay, so we got a couple minutes left. Time for the lightning round. You use this phrase, healthy at 100 at 23andMe. How do you define that? And what are some things that you do to make sure that you're still healthy at 100?
Oh, I sometimes like there's all these amazing pictures of people doing like handstands at 100, and there's these like marathoners at 100. I want to be like thriving at 100 years old, and I do think the power of genomic information, especially once you can get to a world where everyone has like full human, full whole genome sequencing at some point, is that you can eliminate preventable deaths. Like people who have carrier mutations for, potentially pathogenic or really severe conditions, help eliminate that, and then help people understand what are the environmental things that they need to do to have their best chance at being healthy at 100. And I think that's where if we can help people understand, like life is a sum of what you've done every day, or your health at health at 60, it's not like you suddenly wake up and you're like, today I'm gonna eat kale. And that McDonald's for the last 60 years don't matter. Like, no, it's a sum of everything you've done. So help people understand that any one day doesn't matter, but what you've done every day, adds up. And so how do we help guide people? And that's why I look at like the product that we need to create for the future is your lifelong partner. Like, how do we help you throughout that whole journey? So we can't, like, I'm not gonna give a money back guarantee at like healthy at 100, but like your best chance of being that healthy at 100 individual.
Do you find people changing their habits based on what they find out? Because a lot of this comes down to population health that we know. Yeah. Like eat your vegetables, sleep 8 hours a night, get exercise.
Yeah, but I think that people like my dermatologist, I remember being upset. He's like, oh, someone came into my office and they're blonde, they're like redhead and blue-eyed, and they were worried about melanoma. And I could have told them before that they were, high risk for melanoma. They came in with their 23andMe results. And I was like, yeah, but I got them to come in. And I think that I totally agree. Like, listen, if everybody like ate their veggies and like slept well and like, exercised all the time, 100%. But we give people a reason to care and to focus on that area. And there are areas that you wouldn't necessarily, like macular degeneration, start getting screened. You can eat, there are the studies that on vitamins and like how your diet and your lifestyle, but you can start getting screened. So I do think that we can give people a reason why. And I do think even things like mammograms and colonoscopies, like no one's like super excited to turn 40 or 50 and get a colonoscopy. So it would be much better if you could actually understand, like not all 40-year-olds are the same. So who's really the highest risk? Who should really do it annually? Who should actually do it, when they're 60? Like help people understand. Like my goal one day is that U.S. Prevention Task Force guidelines are personalized and that everyone has a different set of recommendations. And I think then people are going to be more responsive to the advice because it's not generic. Like right now, I go to the doctor and they give me like a really ugly black and white handout. I don't know. You guys, like it's not TikTok. Like we need to do better. Like make it fun.
Preventing disease. Wouldn't it be nice if we could do more of that?
We will. We are. That's this really. It's like the power of knowing your genome is that you're in control, and you have this ability to see things that you can't otherwise see, and to take action. So it's incredibly powerful. And again, I think on the fact that that first panel there was so much negativity in some ways on 23andMe, but at the end they concluded, well, everyone needs their genome. So okay, I'm delivering it. Where are you all? Like we're making it happen, and that's like the mission of 23andMe. I'm like a rabid dog. I'm gonna make sure every single person in this country and the world has access to genetic information because I see that benefit. We save lives and I improve lives, and I think about all those people in the world where we've impacted their family and we've done amazing things. So it's the power of the genome. So thank you, Francis and Illumina.
Well, I hope you'll have more people enrolled by the time company turns 20.
Oh, 30. We will. Yes.
And you can update us then.
Yeah.
Thanks so much,
Thanks
Ann.
so much.